Hello, my name is Leora, and I am a registered nurse who works in a small community hospital in Virginia. I am an operating room nurse, and I decided to make this video to tell you a bit about what I do as an OR nurse. When people think about nursing, some of the first images that come to mind are bedside nurses or nurses who work in a physician's office. But there are so many other types of nursing out there. You have psychiatric nursing, dialysis nursing, nurse consultants, nurse educators, the list goes on and on. But today I'm going to talk about what it's like to work in the OR. I knew early on in my nursing education that bedside nursing was not for me. And so I looked around at different specialties like dialysis nursing, psychiatric nursing, and OR nursing, and I quickly discovered a love for the operating room. And so the first thing I want to say about working in the OR is that I really love my job. It's fun, there's never a dull moment. I see interesting things on a daily basis. I'm constantly feeling challenged and on my toes, and I just really love it. OR nursing is much different from bedside nursing because it requires a different skill set. You are caring for your patients while they are asleep and they can't speak for themselves. And you also have to learn about your surgical instrumentation and surgical technique. And that's just something that you won't learn anywhere else. So I just want to take a few moments to talk about what a typical day is like for me in the operating room. So OR nursing is part of a broader specialty called perioperative nursing. And perioperative nursing consists of all the phases of surgical care. So you have preoperative nursing, which is the phase right before the patient goes to surgery, and it's the phase where you get them ready for their procedure. Then you have the intraoperative phase, which is where I work, and that is the period when the patient is actually in the operating room and receiving their surgery. And then finally, you have the postoperative phase, which is the period immediately after surgery when the patient is being recovered from anesthesia. My day usually starts in morning report, and in my OR, morning report consists of all the nurses and scrub techs, and we all get together first thing in the morning. It's really the only time that we're all together as a group, and it's an opportunity for us to organize ourselves at the start of the day and talk about things that are important to us. So we talk about safety concerns, logistical issues, we get in-serviced on new products and instruments, those sorts of things. And at the end of report, we get our room assignments, and that's when we learn who we're working with that day and the types of surgeries we're going to be doing. And then we head out to our rooms. And in a room, you'll usually have at least 4 people on your team. You'll have your surgeon, you'll have your anesthesiologist, a scrub tech or a scrub nurse, and a circulating nurse. But for really big surgeries, you might have more people. You might also have an x-ray tech in the room, you might have a perfusionist, and then some surgeons have PAs that come to the OR to assist. In my hospital, OR nurses are trained to circulate and to scrub. My understanding from talking with some nurses from other hospitals is that not all ORs train their nurses to scrub. Their role is that of a circulator. But since I'm trained to do both, I'll talk a little bit about both of those jobs. As a circulating nurse, my job is to manage my room and coordinate the care of my patients and make sure my team has everything they need during the surgery. The ultimate goal during surgery is to make sure that my patients stay safe and that we do all that we can to help them get the best possible outcomes from their surgery. When I'm circulating, I'll go around the room and make sure we have all the equipment that we need. I'll make sure that we have the right case cart for that surgery, and a case cart is just a big cart that has all of this sterile supplies that we need for that surgery. I look up my patient's information, so I look at their H&P, I look at their labs, their medication orders, I pull the antibiotics and the other medications that the surgeon's going to need on the sterile field. And if we need x-ray or blood products or some other service during the operation, I'm the one who coordinates that to make sure that everything we need is available for our patient. So when my room is ready, I go meet my patient and conduct a short interview with them before I bring them back to the operating room. I go over the consent forms with them and verify the procedure that they're having done. I talk about their allergies, their medications, and I answer any questions that they might have about the surgery. This interview only lasts a few minutes, and it's usually the only time that I actually get to spend with my patient while they're awake. So I really try to make it count because I've never met them before, and I just have this very short window of time to build rapport and trust with them before I take them back for their procedure. And, having surgery is a big deal. It's a significant life event for many people, and many patients and their families are very anxious and scared about the thought of having surgery. So you really have to do your best to ease their fears and gain their confidence in a very short period of time. So when I finally get the patient into the room, we do a number of safety checks, or timeouts as we call them. So as soon as the patient enters the room, the first thing we do is we verify their identity and the procedure that we're having done. We verify the laterality, if there's laterality, and we go over their allergies again. Then we get the patient onto the OR bed, and I stay with the anesthesiologist and help get the patient off to sleep and help establish the patient's airway if the anesthesiologist needs help with that. Then after the patient is asleep, I help the surgeon with positioning the patient. And this is extremely important. And a lot of people don't think about it and don't realize it, but depending on the type of surgery that the patient is having, they can get positioned into really unusual looking ways so that we have the proper access to the part of the body that we need to reach. So for instance, the patient might be prone or face down, or in lithotomy position, or positioned on their side for hours on end. And you really have to make sure that in positioning them, you're not harming them. You want to make sure you're not pinching any nerves. You want to make sure that you don't accidentally dislocate one of their joints because you're positioning their extremities carelessly. And you definitely also don't want them to form any pressure ulcers from laying on a bony prominence for hours and hours. What's unique about patient care in the OR is that your patient is asleep, so they can't speak for themselves. They can't tell you if you're hurting them. They can't tell you if they're feeling cold. So you really have to be a strong patient advocate in the operating room and really speak up for them if you feel that something doesn't seem right or doesn't seem safe. Then once the patient is positioned and the surgical site has been cleaned and all the sterile drapes are on the patient, everyone stops what they're doing and we do another safety timeout right before the surgeon makes incision. When the surgery is underway, I do my charting, I pull meds, and I get whatever else the surgeon or the scrub tech or the anesthesiologist needs. As a circulator, I'm not actually scrubbed into the surgery. Rather, I am keeping an overall view of what's happening with the patient and what's happening in the room. And I just make sure that everyone stays safe and has what they need. Once the surgery is over, we do a final timeout to verify the procedure that we just did, and then the anesthesiologist and I will take the patient over to PACU so that they can recover there. Then we clean up and we do it all over again with the next patient. The other role that I have in the OR is that of a scrub nurse. When you scrub, you wear sterile attire and you're working in the sterile field and assisting the surgeon with the procedure. When I scrub, I'm responsible for setting up the sterile field, setting up all the instrumentation, passing instruments, and directly assisting the surgeon. And even when you're in this role as a scrub nurse and you're focused on a very specific body part and a very specific problem, you still have the responsibility to watch out for your patient and to advocate for them. So when you scrub, you advocate for your patient by maintaining and protecting your sterile field. Because the whole point of performing a sterile procedure is to minimize the risk of infection. So when you scrub, the most important thing for you to do is to work with integrity and have a strong surgical conscience. So if you're setting up your sterile table, for instance, and you're setting up all of your sterile instruments, and let's say you notice a random eyelash on the back of your table, you have to have the honesty and the integrity to speak up about it, even though you know it means tearing everything down and starting all over from scratch, because you'll be protecting your patient that way. So that's just a quick overview of the different roles and responsibilities that I have in the OR. I work mostly in orthopedics. I do a lot of total joint replacements, spinal fusions, fractures, and joint arthroscopies. But we have a lot of different services in the OR where I work, so I get to kind of dabble in all the other areas as well. We have general surgery, GYN, urology, dental, ENT, vascular surgery, plastics, ortho, and we have a cardiac team as well. And if you go to other hospitals, then they might have different services as well. I really enjoy working in the OR for a number of different reasons. One of the biggest draws for me is that my patient load will always be one. You can only care for one surgical patient at a time, so no matter how crazy the OR might be on any given day, I will always be caring for one patient at a time, and I can devote my full attention to him or to her until their surgery is completed. I also really like working with a team of people. As I mentioned earlier, for every patient, there will usually be at least 4 of us caring for them. And even though we all do our own thing, taking care of that patient is very much a collaborative effort where everyone's job is important in some way. I also just really love dealing with all the anatomy and seeing all these parts of the body that you normally wouldn't get to see. And I just think it's really fascinating. You get to see peristalsis in action. You get to see that nasty bone fracture. You get to hold that gallbladder that's full of stones. And it's just something that fascinates me. And I think it's just really cool and interesting. And finally, I also really like the sense of completion that I get from working in an operating room. You have a patient who has a problem, they come in, you do the surgery, and then they leave your care. And I really like just being able to start and finish something with my patient. As far as my dislikes go about working in the OR, there's not really a whole lot that I dislike about working where I work. We do have to take call, and that always puts me on edge because you just don't know if you're going to be working or not, and that just kind of stresses me out a bit. But I'd say that the thing that I dislike the most about working in an operating room is that I don't ever get to see patient outcomes, because when my patient leaves my care, then that's it. I don't see them again. I don't follow up with them in any way. And I just wish that I could see their progress throughout the recovery period. So I think that's it. That's what it's like working as an OR nurse. It's definitely not for everyone. And I found that people either love it or hate it. There's no in between when it comes to OR nursing. Many people have come and found that they really like working here in the OR, but there have also been a lot of people who've come and it's much more different than they expected, or they really miss being able to form those closer bonds with their patients, so they end up going to a different unit that allows them to form those stronger connections and engage in a more traditional style of nursing. But those of us who like it really love it. And it's a really close-knit community of professionals who put their patients first, and it's just a very interesting and challenging area to work in. So if this is an area that intrigues you, definitely look more into it and give it a go. Good luck.